Welcome to the highly trained and wildly unfiltered podcast. I am your host. This is the no BS breakdown of the human body. I am Dr. Peter Wohl, and I am here with Keri Moran, physical therapist extraordinaire and clinical genius. Let's get to it.
That's generous.
Well,
forgive me because this is my first podcast.
She didn't even know she had to speak into the microphone.
So I've been a physical therapist for 27 years now, and I've had the pleasure of working at the Spine Health Center for the last 11 years. And Kim and I pretty much started within months of each other here. So today we are going to showcase Dr. Kim Delmage, who is a pediatric specialist as well as a pre- and postnatal specialist. For anybody who doesn't know what that is, that's for anybody who is pregnant, having all sorts of issues, and then after their pregnancy, having issues, and then taking care of their babies as well. So I'd love to introduce Dr. Kimberly Delmage.
Welcome, Dr. Kim.
Oh my goodness, they put me in the hot seat. Everybody, we're in trouble.
Well, you have to talk into the microphone too.
Okay,
Nobody's
I'm
gonna
talking
hear you
in-
guys. I'm the loudest human being on earth. I can put the
You
microphone.
don't need a microphone.
I don't need a mic. They can all hear me.
Need a
so.
microphone.
You should turn yours off.
I can do that. So,
Okay.
Dr. Kim,
Yes.
tell us what you do. Why are we filled in our waiting room with pregnant women and very small children?
Okay. So first and foremost, pregnancy has been kind of turned by the medical community into a clinical condition that needs to be treated. And we need to revert back to it's a normal human process. There are changes that occur in a woman's body, in her posture, in her hormones, and there are natural things that happen that we can help happen naturally and without pain. Pain is your body's signal there's something wrong. Pregnancy is not supposed to be painful. Labor, on the other hand, painful. Done that 3 times. But pregnancy is not painful. You're not supposed to have pain just because this is a Dr. Pete direct quote, just because it's common doesn't mean it's normal.
That's right.
Okay? It is not normal to have pain shooting down your leg. It's not pain to have what they've now termed as fire crotch. Yeah, you should not have shooting, stabbing pains when you're moving around. You should be able to roll over in bed at night. It might be a little harder to do as your pregnancy progresses, but it shouldn't be painful. You shouldn't be able to say, I can't go back to sleep after I have to roll over because I'm in so much pain. The whole thing is the medical community has turned it into more of a start to finish, we have to treat this. And instead, it's supposed to be, let's support this. Let's help women be more comfortable and enjoy the process.
What are some of the most common issues that you're seeing right now? Like, because I'm assuming right now is different than 100 years ago. We have different issues.
Very different.
When I say we.
Yeah.
Out of everybody in this room, I cannot put we in here.
You have plenty of issues.
Issues, yes. Not with
the
that.
female body. Yeah. At least not that we know of. I don't know.
That's true. So women are in the workforce more than ever.
On your feet a lot
more.
more.
We're on our feet. We are sitting at computers all day, especially with the changing posture and the changing center of gravity. Sitting in a standard office chair, which was designed by men for men, by the way. It's meant for 5.
I feel like we need to fact check that. Always getting blamed for everything.
Yes, that's right. Women, your feet should be able to touch the floor. If you could see right now, that I needed a step stool to get in this chair.
She did.
I did. Feet should be on the floor. Keyboard should be positioned a certain way. And as you're uncomfortable during pregnancy and things are changing, you're not able to maintain that proper posture. And we need to be able to support that more.
Yeah.
And I also see a lot of women complain about not only when they're sitting for a long time, when they're standing for a long time, but things as simple as getting in and out of the car are very, very painful because the way the pelvis is moving around, and even when the pelvis is too stationary from sitting in a chair, they have that fire crotch that we talked about before, where the bones in the front of the pelvis are actually rubbing together, and they get that sensation of stabbing pain there, which can be incapacitating for some.
So, like, obviously, I know, like, I think somebody being pregnant that doesn't understand what chiropractors would do and just think that you guys just crack people, right? And they're scared, I don't want to get cracked.
Yes.
What would be like treatment protocols that you would do with somebody who is pregnant that obviously we know you can't put on like stimulation, electric stimulation,
Right.
which often relaxes the muscles. What are some manual techniques you would do to ease some of that?
So one of the biggest things that women are surprised about when they come is we have special pillows that you can lay on your stomach, which some women are like, can I please sleep here?
Yeah, it's finally
Oh
comfortable.
God! Anybody
Finally able to
yeah,
lay on your belly.
stomach, yeah.
Supports the weight, doesn't have any pressure on the baby. And we do a lot of stretching and manual muscle work where we're really kind of stretching those muscles that are straining as your baby's growing and relieve a lot of the pressure that's on those nerves that are being pulled and pushed in all the different directions. None of the big twisting, popping, cracking noises. And because your body's so full of hormones that are naturally going to help
Right.
your pelvis expand to let the baby out, most of the movements are very gentle because when you put the force in, it doesn't take a lot to move that. Thanks
Right.
to that hormone.
Relaxing.
Relaxing
It's a great
hormone.
name. Nobody forgets that one. Relaxing.
Right,
It's
relaxing.
relaxing your
It's
ligaments,
relaxing
right?
the
Very
ligaments.
true. Well, now I know one of the things that we see a lot, you have women at the end of their term, really far in, 38 weeks, 40 weeks coming in, where they are being told that they have to have a scheduled C-section. Their baby is in a breech formation. And there's a technique that you do called the Webster technique. And I
Yes.
can personally say for Kim, I've seen beautiful success stories of women that come
Absolutely.
into her that are scheduled for C-sections, which is a lot of recovery. I had C-section after twins. It's definitely a different than natural. But they were able to deliver their baby, you know, head down, beautiful position, and have a normal, beautiful birth, which is what they had originally planned
Exactly.
for. So, like, what is that
So
Webster technique?
The Webster technique has actually been around for probably 40, almost 50 years. It was developed by a chiropractor who watched his daughter struggle through her pregnancy, and it is all about balancing the pelvis. There are ligaments that are between all of the bones in the pelvis. The pelvis is actually made up of 3 bones, the tailbone in the back and the hips on each side, and each of them move independently. When they're not moving balanced, one of those ligaments can become strained and cause irritation, and then we're not having the baby find a comfortable position. There's especially 2 ligaments that the Webster technique focuses on called the round ligaments. Round ligament pain is something that a lot of women will read about. It's pain in the groin when you're changing positions, trying to stand up, and you get that stabbing pain in the groin. But what those round ligaments do, they actually work like 2 hammocks that sit. They go from the tailbone in the back and come under the uterus like a sling on either side. When one side is tighter than the other, it's kind of like having a hot air balloon. If the strings on one side are pulled too tight, the uterus will actually tilt in that position, and it will make it uncomfortable for the baby. I don't want to put my head somewhere where it's tight and uncomfortable. Right. The baby will move away from that. So what the Webster technique does, it is not designed to turn a breech baby. Right. People hear that and they're like, oh, you turn babies. We don't turn babies. We make you, so your body is in the proper capacity and position so that the baby can turn itself naturally. The weight of the baby's head, we've all seen babies with, got to hold the baby's head. The weight of their head is 2/3 of their whole body weight. Gravity is gonna want to pull it down. So by allowing those ligaments to be relaxed and the pelvis to be in the right position, the baby will naturally turn and go into the right position.
It's beautiful.
It's pretty simple. It makes a heck of a
Yeah.
lot of sense. I don't know how to argue with that.
And it's a natural way of doing it. Like, to me, it's like,
Right.
why not give it a try, right? Because there's no contraindications
there
to
are
it where somebody...
no risk
right?
factors to it. We are not pushing on the uterus. We are not doing anything that could actually cause harm to the mom or the baby.
Yeah.
In fact, one of the great things that I love to tell women, there are only positive side effects.
Right.
Find one other thing in this world that has only positive side effects.
Yeah, so that's great. I mean, I know I had placenta previous, so that's not an option is to
Right.
deliver normally. But if for women that do not have that condition, that the option is there, I think it's a great technique to try just to see if it does revert that process for you and put you in that position to do
Exactly.
so.
Is there a percentage of women that would prefer to have a C-section versus a natural vaginal delivery, or is that?
I could say I've had some friends that didn't mind being scheduled, and they
Yes.
looked a lot better than me because they had their makeup done and were taking beautiful pictures
Yes.
because
So-
they were scheduled for
Is that a-
C-sections. And I was
all
like,
right.
my cousin actually was on the front of the Valley magazine. She's a nurse at Valley, and her C-section was scheduled, and she's this gorgeous like model on the front cover, literally as she's doing her C-section. So I don't know. I feel like that might be
Not
for some
2:30 a.m.
person.
Water broke and my
Yeah.
hair is out here. My
face is swollen.
I'm going. We gotta go to the hospital now with your go bag and the whole
Say, at the
nine
end of the day,
yards.
it's a personal decision. Some
Yeah.
women do
Yeah.
feel that they like the knowledge, knowing exactly when the baby's coming, and they know, they're not going to have changes to their pelvic floor necessarily.
And
Right.
many, like the nice thing about the West are many women who get a C-section the first time, that is their road for future births no matter what. Regardless of what position your baby's in, the kind of pregnancy you have, you
Right.
could be perfect for a regular vaginal delivery, and yet they're still going to schedule you for a C-section.
Yeah.
So for many women, it's that first one. If you could try to
Yes.
work on that one, that sets your path up a little bit better,
Yeah,
right?
absolutely. If they want to. And by the way, if you prefer to get the C-section, there's still not a problem with making the uterus the most comfortable place for that baby to be. Whether they're head up, head down, whatever it is, you're still in a much better position. Then go have a C-section or have the potential of having a natural delivery.
So
as
now
well.
I see, like, when they come in after, you do treat a lot of women with C-sections,
I do.
working
Absolutely.
mobile, like, and other post-pregnancy issues,
Yes.
correct? Yes.
Because the way a C-section is done, you are cutting through, 7 layers.
Yeah.
And they're cutting through your core. It's everybody's all about
big
the core.
buzzword, the core, yep, sure.
They've just sliced through that.
Yeah.
Okay. And now we're all carrying the big infant carrier. You're struggling to find postures while you're breastfeeding or bottle feeding, and they've sliced through your muscles. It's really important that we're helping all the other muscles heal at the same time, helping the spine to be moving as it should be in the safest way possible.
Right, because now you're also, like, taking care of a baby, holding a baby.
Absolutely.
Breastfeeding, so you're in that, a slightly hunched position. A lot of women get into that. I know you fixed a lot of women's position when they're
The
breastfeeding
number
to
one
help them.
complaint with postpartum that I see is the mom hunch.
Yeah.
They all come in, upper back, between the shoulder blades, back of the neck, headaches up here. Because who doesn't want to look down at that
Yeah,
cute little
cute
baby
little baby.
for hours and hours and hours? And then suddenly when you go to stand up, you're still stuck in this position.
Yeah.
And it sounds so difficult and complicated for having one baby, but your patients sometimes already have another baby or another child
yeah,
that
we
you're
have
taking
a
care of
lot
at the
of-
exact same time as
We
its
do. We have a
newborn.
lot of moms who bring their toddlers in with them. I encourage all the time. This is a family-friendly space. My room that I treat in, we have a bench on the side and kids' toys and a cute little chair for kids because it's a great experience, especially for little kids, to see their parents taking care of themselves, building healthy habits. And we like to encourage everyone to come in, see how well they can feel, and make it a good, healthy habit.
Now, I have to say, when you say everyone come in, this is the one that blows my mind. When I see somebody walking in, and I'm assuming when we first started seeing real babies, little, like 3 to 5 day old babies, I just thought they were there with the mother to come in with the mother while the mother got treated. But then it was the patient that surprised me because it was a 3-day-old baby.
3-day-old baby,
So
yeah.
what the hell are you doing with a 3-day-old baby? And why would anybody think to bring their little baby to a chiropractor? So that's
Okay.
what always stumps me, but I see it every time with you.
You do, absolutely. So the youngest babies I've ever adjusted were my own in the hospital before we ever left. If you have ever watched a video of a child being born via vaginal or C-section, if you watch the force that's put on their little head and neck and the way they twist and turn to have them come out into the world, I'll tell you what, if somebody touched my head and neck like that and yanked on it, I would need to be adjusted pretty badly.
Yeah.
So people always say, are you going to crack my baby? I'm not going to crack your baby.
There's nothing to crack.
There's nothing to crack. The joints aren't fully formed.
They're not even bones. It's
Right?
just cartilage. There's
Rubbery.
nothing.
But they do have all those ligaments, all the muscles in there, and those muscles can get really tense. So most of the force that we use on those newborn babies is about what you would use to check the ripeness of a peach. Okay?
Yeah.
So just holding that little bit of pressure on that area, they're able to release My favorite thing to watch when I work on these little babies who are all scrunched and uncomfortable is when their little neck just starts to stretch out and the parents' eyes light up and they're like, my baby has a neck?
Yeah.
I can clean in there now?
Yeah.
And you've
The
seen them go from
folds,
like squirming and like you can
crying
see they're
and
unhappy, and then all of a
screaming,
sudden you do your magic and
I
you
hit
see the
that
baby
spot.
just
Instantaneous
and even
relaxation.
fall asleep. They fall asleep sometimes too.
Most
They're like,
of them do. Most of them, you find that spot and you just see the look on their little face and they just relax. And
how about for like colicky babies? Like I know that's a big one for moms. Like
Absolutely.
bloating issues, like going to the bathroom with these newborn babies.
reflux,
Just,
constipation, it's a big, big thing. Because the nerves that are in the upper part of the back, like right at the base of the neck and between the shoulder blades, like right in this area here, that was a big spot where they're transitioning as you move that neck as they come out. So those nerves go to the top of the stomach where the esophagus meets the stomach. We all have a little valve there that opens and closes as food goes in. It's supposed to stay shut. If the nerve telling it to stay shut doesn't communicate well, especially in a brand new, just learning how to eat food, it will stay open. You lay that baby down and bloop, everywhere. Yeah. So baby
Never had that happen before, right?
How much laundry did we do? So especially for babies with reflux, constipation, where the nerves need to communicate to those organs.
Yeah.
We take the stress from around that area. I have parents who give me a call from the parking lot, like I did last week. Their baby hadn't pooped in a week. It was extremely uncomfortable, grunting, drawing up the legs. They're trying to do the bicycle and all this stuff. They call me from the parking lot. We have to come back inside because our baby just exploded out their diaper, and we can't do this in the car.
That's
of course,
crazy.
they come on back in, and we.
It's true. We all learn.
Makes me so happy.
Yeah, we all learn. Like in chiropractic school, we understand the birthing process and the textbook in obstetrics and gynecological studies tell the provider to twist the baby's neck to get the one shoulder out, and then almost 180 degrees to the other side to get the other shoulder out, obviously with a vaginal delivery, but there's still force in a C-section as well. And, they always coined it in chiropractic school as the first subluxation. Of course, when something gets out of alignment and there is potential for it to cause interference with the nervous system.
Right.
We can all, I hopefully agree that the brain controls every single cell in your body, and that communication pathway goes through those nerves. And so if something's interfering with the communication, as you were saying, then wherever that nerve is going to, the valve doesn't get the information it needs and it doesn't close.
Yeah.
So by opening that up and allowing the nervous system to communicate itself, your body can show optimal health. And that's kind of what that's all
and
about.
I'll say, I mean, I was in labor with Haley for 20 hours. She's 19.
Say that again?
Did you say really good times.
Woo!
So a tough labor, and she was colicky and did not sleep through the night until she was like 15 months old. And then 4 years later, my twins literally emergency C-section, and I remember the feeling of them in me pulling them down and the stress. I don't know what they're going through. You don't even think about that. You're just happy everything went well. You've got happy breathing babies, right? That sounds great. Yep. Again, colicky, reflux, miserable. They didn't sleep through night till they 18 months. So who's also very unhappy as a working mama and trying to keep her shit all together. But I just wish that I knew about this because I didn't. And I met you 11 years ago and I didn't know. But I feel like for moms, it's never too late.
You still have time.
You know what I mean?
You get one more. You got to give that one a shot.
No. We are done.
We're done. Shop's closed, as Kelly would say.
I was going to say, Keri and I, our first daughters, each just finished their first year of college. So
yes.
No more babies.
We're moving into a better direction.
We love all of babies.
I love when your babies visit.
Yes.
Seems like a young woman's game, huh? All right.
Definitely.
All right. I can understand.
So I would say, Kim, this has been just amazing, and I feel like we've learned so much. But like, there's so much more to go into, and I feel like the next segment that I would love to introduce you to is like where that goes to next, because I've also seen you working with babies who are developmentally delayed, which as a PT I also work with, difficulty getting up into quadruped or just staying on their bellies or tolerating that prone belly time.
Any delays in that first year and beyond, it's very much the nervous system communicating with the body. And if there's a disconnect somewhere in there, we need to help them out.
Yeah. So I would love to follow up with a segment with you as, kind of like getting out of that newborn stage and where we develop when they start moving and crawling, and then the toddlers, which are fun. And as you know, you treat adolescents, teens, and all the way through life.
All the way through.
That's it.
I love it.
So your youngest patient is hours old, your oldest patient?
102.
I never got to 100. I've had that.
Really?
I'm looking for a 100-year-old patient. My children
I
were my
did.
first
I had-
patients in hours old.
I go
so
from 2 hours to 102. That's one of my favorite things to say.
I'm jealous.
Cool.
I'm jealous.
That is really cool.
Very, very cool. I love it. We talked about prenatal. We talked about labor. We talked about postnatal. We talked about babies. I mean, to think that there's still so much more.
Oh, so
We're gonna have to put this into another, at least one segment, but we're gonna probably even throw another third segment in there as well.
gonna drag
You
it
don't
back
mind,
in
do you?
there. Not as long as you bring the step stool so I can get in the chair.
You know what? Listen, I will bring the step stool with my co-host and clinical genius,
Oh my
Clinical
gosh.
genius.
Keri Moran. I am Dr. Pete. This is the highly trained and wildly unfiltered podcast. We're going to be launching this right now. This is our first episode, but our intention is to constantly provide this type of content for you guys and everybody out there. So listen in. You guys will keep on getting some more information. And Keri, I got to tell you, you did a fantastic job.
Oh, for my first one. Not
I
so bad.
think you're hired. Permanent
boy.
co-host
Oh, no.
over here.
Oh, no.
I think
a
it's
lot
happening.
of time
So
with Dr. Pete.
There we
guys.
go.
It's a lot of
Ah,
time. I don't know. You can give me a
20
thumbs
minutes.
down if you'd like to help me out a little bit.
we'll grab your feedback, guys. If you don't want Keri on the show, you let us know. But in the
Or if you
future,
don't want
though,
Dr. Pete. It's okay.
there we go. All right. Well, we can have Dr. Kim and Keri do the whole thing over there.
And
So
also for anybody, like the Spine Health Center of Montvale is where Kim is out of. If anybody ever just wants a consultation, by all means, you can call. You set up 15-minute consultations just to see if you're the right candidate, that's somebody that Kim could help or work with, or if you have questions that you don't even understand if you could be helped, please feel free to reach out to us at any time.
Absolutely. I love to have chats with mom on the phone, give them that sense of, you're not crazy.
Yeah.
This is something we can help, or, this might be something that we get you to whatever expert your baby needs to be
Correct,
at.
yeah.
absolutely.
And kids love her, guys. They really, really do.
It's really crazy. You should
I
see what's
love-
going on in here.
I love
Mine.
when they come running in and give me hugs.
Yeah.
My favorite.
Even
Best
my
part of my
kids.
day.
I'm a chiropractor, and they're begging for Dr. Kim.
See,
They're like, we don't like
Yeah.
that. I want that.
Amazing. Thank you so much,
Thank
Dr.
you,
Kim.
Kim.
Thank you for having
Dr.
me.
Kim on the next one as well. Guys, wait for it. We're going to do sensory
More.
and some other stuff. So if you guys are waiting
Absolutely.
for it, bye, everybody.
Bye. Thank you.